I'm going to bring a timer so that we have
Oh,
a clue as
well,
to where I'm
we,
at. Myself.
thank you, sir.
So I'm Dr. Michael Karlfeldt. I run an integrative healthcare facility in Meridian, Idaho. And I do believe in utilizing all aspects of both holistic and medical, bring them together and do the best of all worlds. Next, please. Do I click or somebody else?
No, just say next.
Oh, next.
He did say next.
Right, so.
Thank you.
There's, thank you.
So, the focus, I'm not here to convince anyone, because I feel it's a man's mind that's not really here posting information. All I'm wanting to do is to cast doubt on what we're dealing with. I'm wanting to highlight some flaws of the current testing, and also wanting to point out some of the ineffectiveness and potential harm of the broad policy of public mask wearing. So when you're talking about double-blind studies, these are things that we would like to see. And also in regards to the vaccines that they're rolling out, where are the studies? Also, highlighting some alternative treatments available, versus having a National Guard military delivery of Operation Warp Speed, Moderna, Pfizer vaccine that is not properly tested for safety with high potential harm. So in the medical profession, it says first do no harm. And also you always need to look at is the cure more dangerous than the disease. Next, please. So, so what does it mean when you're tested positive from the coronavirus? So we're using the PCR test, and PCR test is you can use it as a quantitative test, meaning that you can see how infected is the individual. And that depends on how many cycles you need in order to be able to find then the virus. So right now we're just using it as yes or no answer, which is not really that effective. So the PCR, what it does is amplifies on genetic material from virus in cycles. So again, the fewer cycles required, the greater amount of virus or viral load in the sample. The greater the viral load, the more likely the patient is to be contagious. Next, please. So here's the interesting thing. So they did it in 3 sets of testing data that include cycle thresholds compiled by officials in Massachusetts, New York, and Nevada. They have up to 90% of people testing positive carry barely any virus. So 90% of them have barely any virus. So what does it mean then to be testing positive if 90% of them barely have any virus? So one solution would then be to adjust the cycle threshold, because in some states they do up to 45. Most tests they are at 40, some at 37. So that means that you're positive for coronavirus if the test process required up to 40 cycles or 37 or 45, depending on where they're at. There's really no, I don't think there's been a standard that's been set from state to state. If whoever feels like they want to do whatever amount of cycle, that's what they seem to do. So what are we testing? So the test, what we're doing is that we're looking for genetic fragments. So these are leftovers from the infection, and these genetic fragments, we really don't know if these genetic fragments is causing any disease or if you're infected. I mean, you're finding the genetic fragments, but again, it's kind of like finding a hair in a room after a person's left. You're just seeing something that is there, the genetic fragment, but is that person infected or not? So again, 90% of people testing positive barely carried any virus. So the CDC's own calculation suggests that it's extremely difficult to detect any live virus in a sample above the threshold of 33 cycles. So, also was pointed out priorly that a PCR test was not designed to diagnose disease. It was designed, the creator who, passed away about a year ago, was designed to manufacture. So you replicate genetic materials, and it was designed then for manufacturing. Next, please. So what are the implications of this data that we are bringing forward? You know, we have the 90% of people that think they are infected when they're not. So obviously we have financial, you know, which is excessive closure of businesses and employee sick days. So people are having to call in sick because they tested positive. So now they cannot perform the duties, they cannot receive pay, impact their family, impact, you know, so it has a huge cascading effect. Educationally, you know, talking about closure of schools, you know, and that is a huge concern. What are we doing to our children right now? I mean, what kind of education are they getting amidst all of this? Medically, you know, so now we are allocating sets of medical resources, you know, towards this, instead of focusing on other medical care. You know, people still dying from cancer, they're still dying from sepsis, you know, they're still dying from heart attack, there's stroke, you know, so these are things that are still out there that we need the medical profession to be able to be available. I mean, they play a very important role, and we don't want that part to be taken away. We need that. And then you have the emotional aspect. You know, you have the isolation, loss of community. You know, so increasing rates of depression that Dr. Bates was talking about, anxiety and suicide. CDC survey, and this is just focusing on one group, at the end of June, found 1 in 4 in age group 18 to 24 had considered suicide the last 30 days. 25% of our 18 to 24, this is our next generation to carry the United States, and they're considering suicide. So we're doing something wrong. Spiritually, you know, we're now imposing limitations on public worship. You know, we're limiting our ability to worship God. Next, please. So what is the current threat of COVID? So, and we obviously have dying from COVID versus with COVID. And and from my understanding, you have federal financial incentives to document COVID deaths. So, you know, we are hearing stories, and I've heard the same. People dying in car accidents and was COVID on their death certificate. Had cancer patients that had to try to argue to get COVID away from the death certificate. I've had patients with heart attacks, same thing. So since PCR tests are hypersensitive, you know, 40 versus 33 cycles, with a reason that the amount of deaths are inflated, as well as the number of infected, maybe by a factor of 10. So it looks like we then have to divide these numbers quite greatly. And Dr. Becky is talking about T-cell immunity. You know, why are we discounting our ability to fight infectious agents? You know, why are we now only relying on scientific measure versus our God-given right? So here's a study, or here's a work funded by NIH, National Institute of Allergy and Infectious Disease, published August 4th, 2020, found that, well, the SARS-CoV-2 and common cold coronavirus fragments that were most similar, they saw 57 cross-reactivity by memory T cells. So it means an individual that has a common cold, that created a T cell cross-immunity by 57%. So it means that even though we may not be exposed to the specific virus we're dealing with right now, the SARS-CoV-2, but because of what we've dealt with in the past, our T cells have a memory to address and to support the immune system in that area. So supporting the immune system becomes crucial. Again, medical motto, first do no harm, and are we doing more harm by overreacting? Next, please. Next, please. Oh, I'm sorry. Can you back up one? being inpatient. Okay, so the mask, how effective is it? So far, you're talking about studies. No study exists that shows a benefit from a broad policy to wear masks in public. It doesn't exist. To date, its benefit to prevent spread has not scientifically been validated. It is based on assumptions. It's exactly the same as we once assumed the Earth was flat. It looks obvious. I can't see beyond the horizon over there, so it's got to stop. And it's the same thing. We got a mask. So, well, that would seem obvious when I'm coughing. Obviously it stops something, right? And yes, it does stop something. It stops about 90% of these, little droplets. But what are these stopping? Well, they're stopping the big droplets, the things that pretty much just fall on the ground. I mean, when we're dealing with Ebola, right now we have a 6 feet distancing. Ebola, we had a 3 feet distancing. So what is Ebola less dangerous than this? Or I'm a little confused where we got the 6, 3. So the viruses, they're tiny. So the ones that hang out in the air for a longer period of time, these are the tiny, tiny components. And the mask, I mean, there's basic physics and biology. The mask can't stop that. It will still go through the mask. So I'll go back to that a little bit later. Here's kind of an interesting thing. There was a 50% decrease in post-operative infections reported after omitting surgical masks. So getting rid of the surgical mask, then 50% decrease in post-operative infections. So now we're dealing with a group, a person being operated on. I mean, I would consider that as an immunocompromised individual, but we're dealing with a decrease. And this was after, 3,088 patients, so it's not a small study. Next, please. So here, we're looking at transmission. Oh, thank you. Appreciate that. Transmission done through exhaled breath. It hasn't actually been proven. It hasn't. So if that hasn't been proven, then obviously all other findings are irrelevant. So the only way to prove the presence of a virus in an air sample is to actually see the virus under an electron microscope. All we've seen are little genetic fragments. We haven't actually seen the virus. So the WHO says that the evidence of viral RNA in an aerosol or droplet is not indicative of viable virus that could be transmissible. So there's little evidence to support the effectiveness of face masks to reduce the risk of infection. So that's Cambridge University Press. Fairly prestigious location. Next, please. So now we're looking at the potential harm. So if we have established that there's nothing scientifically proven that this benefits us, so could there be a harm? Well, so as we're having the mask, obviously, if you use the loaded mask, it can actually become a source of enhanced transmission for the wearer and people around you. So here you got a mask, and you are breathing out these droplets that is the environment. Things replicate in human warm environments. And then you're adjusting it, and then you're touching a handle, or then you're picking up the fruit, and then somebody else comes after, touches that handle, picks up that fruit. So now you're creating a greater risk of spread using the mask. So the mask becomes collectors and retainers of pathogens that the mask wearer would otherwise avoid when breathing without a mask. So we're adding a layer of contamination using the mask. So droplets captured by mask atomize or aerosols into breathable components. So the question is, can virus escape an evaporating droplet stuck to mask fiber? So let's say we are capturing these little bigger droplets with virus in them, And these are the ones that are heavier that would have just fall into the ground anyway. And the ones that are aerosol, the tiny ones, I mean, obviously the mass, the force within the mass is not big enough to stop them, so they're going to still be out in the air. So there's no change there. So, but now we have these things that would fall into the ground, they're now in the mass, and now every time we're breathing, now we have a chance to then aerosol those particles out and to make them hang in the air. So now we're increasing the concentration of those particles in the air. So, talked about dangers of bacterial and fungal growth on used and loaded mats. What happens in the mat, what's in the mat when you're creating that environment. Again, touching, what happens. Then we have the long-term health effects. People are complaining about headache, anxiety, rising from rebreathing air with 10 times increased carbon dioxide level. So normal air has 0.4% of carbon dioxide. Exhaled air has 4%. So, in one of my interviews that I did, I run a radio show where I get to interview smart people. So this was a researcher in brain psychology, and she mentioned that just a slight, minute increase of carbon dioxide in the air that you're breathing in, hardly detectable, increases anxiety and anger tremendously. Just a minuscule change, and here we have a 10-time increase change. So what kind of impact does that have on your body? So, and then we're also looking at the negative social consequences to mass society. Children's neural development, empathy, feeling disconnected, all these different things that take place when you're walking around in society with everyone walking around with a mask. So, and this is really important for me with children. I have 4 children. So face recognition is an important index in the formation of social cognition and neurodevelopment in humans. So if we take away face recognition, the impact it has on our children in their neural development. We're trained to read faces and then respond so that we can interact with our group around us. And if we take away that portion of the training, the part of the brain that does that becomes underdeveloped. And what are the long-term consequences of that in our children? Negative psychological consequences, wearing masks, fear-based behavior modification, environmental consequences. Now we've got a bunch of masks we got to get rid of, or we're going to put them. And also this, a friend of a friend runs a lab in Germany, and they kind of check these wonderful masks coming from China, and finding then that they contain a lot of garbage in them, heavy metal particles, some even glass fibers in them, Teflon, formaldehyde. I mean, so we're breathing this in. So here you got weak respiratory tract, and you're going to be breathing that in. What impact is that going to have? You're concerned about a cytokine storm in your lungs, so this will definitely help. Next, please. So these are therapies to explore. So there are other things out there. You got high-dose intravenous vitamin C, this article, inactivation of SARS-CoV-2 by ozone treatment, adjunct low-level laser therapy. And so we do intravenous laser therapy that treats the blood as it's passing by. Photodynamic therapy is the same thing. You use a laser using light, ultraviolet, blue. You can combine that then with like methylene blue, inhibits replication. You have riboflavin, vitamin D2. Combine that with ultraviolet light. It's very, seems to be very effective. Next, please. And so, why the vaccine? So, we got a 3% infection rate, potential inflated by a factor of 10. 2% death rate, potential inflated due to financial incentives. So if you add that, your total death rate should be 3% times 2%, which equals 0.06%, and that's still a highly inflated number. So this is the risk we're dealing with, and we're wanting to create these legislative actions and this financial impact in the United States based upon that number. Now, when we know that T-cell immunity we already protect, and we also, so now we're dealing with the largest, fastest scale up in vaccine manufacturing history. Concerning. And so with this, what they're doing is that they're monitoring the individual for several weeks. Well, that's wonderful. Several weeks. Could something happen maybe in 2 years? I don't know. I would think that it would take a little bit longer time to make sure that this is safe and effective. So what's driving this forward is still that 0.06% that may be in play. So, and one concern, so all the corona studies of vaccines in the past, they failed because of this component here, pathogenic priming, which means that you get the vaccine, so now you have the virus, and then when you're exposed to the virus, now you're primed to have a stronger immune system reaction to that virus, which can then cause severe critical illness and even death, is what they call. So if one drug is safe, are all, so if one vaccine is safe, are all vaccines safe? No, we can't just make that assumption. So thank you so much. I really appreciate you guys taking the time listening to me today.
Thank you, sir.
So, Oregon has 2.5 million more people than Idaho.
Okay.
Washington has 6 million more people than Idaho. Oregon's case rate daily is less than Idaho's, and Washington's the same as Idaho. They both have mask mandates. Why?
Why they have
Why
less-
they are less than us
Okay.
per population.
Yeah, so there's so many factors they got to look at. You could also look at when England introduced mask mandates, and you look at the curve then on case rates, and it just skyrocketed at that time. So,
Well, it's skyrocketing because the infection started before they started the mask mandate. Because it's a 10-day, 2-week event before you'll see an effect.
see the increase, yeah, exactly.
All right,
Yeah,
so that kind of proves against what you just said.
Actually, no, that's not true, I'm sorry. I've got all kinds of.
I disagree.
Yeah.
But you actually don't have the authority to mandate it anyway, so it's the whole point.
I think we do, actually.
No, you actually don't.
Can I say something?
Yes, go ahead, Kelly, please.
You know, my daughter works for a doctor, Dr. Snow in Colwell. Anyway, and she got staph infection from wearing a mask. And that's just a fact. That's a fact. The Dr. Snow will let you know that. The other thing is I used to do soil fumigation. If I was to wear an N95 mask, I wouldn't be sick. I would die. I had to wear a special mask. Full face, special mask. So the chemicals that were in the telephone were so small that you couldn't see them. You couldn't. But they were so small that even an N95 mask or any of that, I would have died out in the field. When you do telephone, you have to have 2 people in the field, the operator and someone to watch, in case your mask fails, because you will die. So we're saying that, you know, that's where I get off on the mask thing, because just like you said, those particles are so small, they're going out there, they're airborne. That's the same thing. If the right mask is the only way you're going to stop the flow of it. And my daughter wore a surgical mask and got a staph infection from it. And that's a fact. You can't deny that. So I have a lot of concerns of what we're trying to do.
And the basic physics, when you're coughing, I mean, unless it's 100% sealed, it's going to go somewhere. You know, so now you're spreading in this direction, you're spreading in this direction. So now you're getting things up in the nasal cavities, which then have a higher introduction to brain, to neural. And then obviously, again, touching things. So I'm not sure, I mean, obviously,
So, but going back to what you said,
Mhm.
that bacteria, where's it coming from? It's coming from your mouth and your nose.
Exactly.
That's already there.
Well,
So,
what is
breathing that,
here, and then bringing that up here,
I'm here to tell you that your mouth and your nose is a hell of a lot dirtier than your mask.
absolutely. And
So
why-
how can you then say that this is doing it?
So why
Because they're already there.
Yeah,
The bacteria are already in your mouth, already in your nose.
but why are you concentrating that and and then you're breathing that deeper in?
It's already going through my nose, already going through my mouth.
Then wear it.
It's already there.
You wear your
God
mask.
created a reason to exhale.
All right, we still have
We're
two
supposed to
presenters,
exhale things, you know.
Okay, let's go on, we're
so,
behind.
we need to get on, we're already, we've kept them waiting an hour. And like I said, this is informational for all of us to hear, and listen, and make our own choices. So now we have, Dr. Michael Schulte and Dr. Sky Blue.